Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in Ayurveda Academy YouTube channel. This is the class of Roganidan and Vikruti Vidyan. And in this class, we will start to talk about some concepts from modern pathology, which is included in the syllabus of BMS course. If you again try to revise that paper 1 topics, Roganidan Vikruti Vidyan, paper 1 topics, I am going to tell you right now immediately. For example, the first topic is Dosha Dushadi Vidyan. Second topic is Vyadhi Vidyan. Third topic that we are started today, that is basic pathology. Then fourth chapter is Nidana Panchak. We have taken a lot of Nidana Panchak, Nidana, Purva Rupa, Rupa, Upashaya, Samprapti. All videos are there. Then the last topic of paper 1 is a Pariksha Vidyan. Of course, I know very much that there is also one video about Dashavidha Pariksha. So please check that video. I know that you are expected to learn about Shadvidha Pariksha, for example, or Ashtavidha Pariksha. Especially Ashtavidha Pariksha is for the short case. Nadi Mutram Malam Jivva Shabda Sparsha Drik Akruti. Nadi Mutram Malam Jivva. Nadi is a pulse. Mutra, urine examination. Mal, stool examination. Jivva, tongue examination. I have already video on the tongue examination. Please check that video. Tongue examination. Nadi Mutram Malam Jivva. Shabda. Shabda is the examination like auscultation. Of course, we understand the words of the patient. Whenever the patient is having feeble sound, doctor, doctor, pain here, I cannot. So this particular voice indicate doctor that this patient's immunity, this patient's strength is lowered down. Okay, so now then Shabda. What is Shabda? Stethoscope, auscultation, respiratory sounds, vesicular sounds. Then also lup, dup, lup, dup. This is also Shabda Pariksha. Then peristaltic sounds. Then in the osteoarthritis, there is a crepitus, movement, pain, and also the sound during the movement of the joint, that is called as a crepitus. Try to understand, okay? So this is the Shabda Pariksha. Even I will add, this is a new trick. Actually, in the ultrasonography, sono, there is a sound. Sound is reflected back. Echo is reflected back. And then gives the idea about that particular physiology or the pathology of the organ. Maybe abdomen, maybe uterus. So that ultrasonography is also Shabda Pariksha. Stethoscope auscultation is Shabda Pariksha. Sparsha. There are two points. Sparsha. One is a palpation and second is a percussion. You know, percussion on the abdomen, on the lung area, percussion. That is a sparsha. Then also we can get a different scopy. You know the scopy, and we look inside and we try to touch the different areas of the inside. Then also we can find out something new finding, that is Sparsha Pariksha. But Sparsha Pariksha will not include scopy. That will included in the Rupa Pariksha, Darshana Pariksha. Rupa is a inspection. Nadi Mutram Balam Jiva Shabda Sparsha Drika. Drika is a vision. And Akriti, figure. That person's figure, whether he is overweight, whether he is lean, or whether he has abnormal tumor over here, any Akriti. Splenomegaly, Akriti is disturbed. Hepatomegaly, the size is big. Cardiomegaly, that is Akriti. Try to understand. If muscle hypertrophy, Akriti is changed. If there is atrophy, Akriti is changed. Are you getting my point? So all these points should be written in Ashtavidha Pariksha. So in this lecture, in the beginning, Dr. Deshpande has covered within 5 minutes the points of Ashtavidha Pariksha. But he has mentioned that you can check the different videos, especially what you can say, I have just mentioned about Nadi Pariksha, pulse examination, separate video is there. Jivha Pariksha, separate video is there. Please check those videos in the playlist of, or you can purchase the app, free download, and there is a clinical examination. Anyway, we coming to the point of basic pathology. First topic we will discuss about the inflammation. Can you see here? सूजन बोलते हिंदी भाषा में सूजन, but there is a little difference. Edema is little bit different, swelling is little bit different, inflammation is little bit different, but all these things, especially inflammation, is a protective. It is protecting your internal organs. Okay, so inflammation is defined, definition, local response triggered by damage to vascularized living tissue. It may be your appendix, it may be your tonsil, it may be your gastric mucosa. So whenever there is a ITRS, will you please write down this suffix I will repeat, ITRS, itis is equal to inflammation. Write down. 2-3 examples you immediately write down. Tonsillitis here. Inflammation of tonsils, tonsillitis. Please write down. Inflammation of the conjunctiva, conjunctivitis. Correct. Inflammation of the bronchi, bronchitis. Inflammation of the lung tissue, pneumonitis. Inflammation of the meninges, meningitis. Inflammation of appendix, appendicitis. Inflammation of the colon, large intestine, colitis. Inflammation of the fallopian tube, salpingitis. So many ITIs. Inflammation of the urinary bladder, yes. Cystitis. Inflammation of the kidney, yes. What is that? Kidney, inflammation of the kidney, nephritis. That's like inflammation of the liver in the jaundice, hepatitis. So all these are the inflammations because it is triggered by damage to the vessels, vascular vessels, blood vessels. It is damage to the blood vessels. Now, what are the causes, hetu, of the inflammation? Just keywords. Please write down this title, definition. You will have to write down definition. Only write down definition. Okay. Then, next, causes. Second point will be causes. In that, you write down right now, immediately. Number 4, 1, 2, 3, 4, 4 causes. What is that? Physical cause. Physical damage. Because of the physical element. Physical. Number 2, chemical attack. Number 3, infections. And number 4, immunological problem. So physical trauma, chemical attack, chemical trauma, infections, and immunological problem. So physical is like a road accident. You get some fall on the ground and you get a trauma. Oh my God, stone here, no helmet. So trauma, that is physical trauma. Then there may be excessive heat because of the burn, for example, hot plate touch. When the ladies are cooking, hot plate touch is a trauma. Then inflammation will be there. Cold, OMG, oh my God, sir, cold also causes inflammation. Because we see, sir, inflammation is always a pitta, na? Yes, that is true. But even extreme cold, if you go to the Himalaya and with the barefoot, you make a snow, you walking, then there will be the frostbite. Write down that word, F-R-O-S-T, frostbite. Trauma is a trauma. Then radiation. For example, X-rays, sun rays, there may be trauma. Then chemical trauma. What is organic poison or inorganic poison that can make the problem of inflammation? For example, simple thing I will explain you. When anybody takes a lot of aspirin tablet, then that particular tablet also can get irritation of the stomach, or the simple alcohol, drinking alcohol in more quantity. This is a chemical agent, and that can make a gastritis. Remember this thing. Then infections. This is the most common. Whatever you have, the bronchitis, meningitis, pneumonitis, all are bacterial infections. So bacteria can cause, virus can give you the inflammation, parasites also can give the inflammation. Then immunological problem like antigen antibody reaction. Huh? Suppose a wrong blood transfusion is given, then there may be inflammation of the blood vessels. Okay. Then cell mediated tissue death. This can occur. Now, next point will be you write down this title. I think you write down all these things because this is the most important point which you should never forget. Whenever inflammation question will be asked, you must write down these 4 or 5 important signs. Signs, very important. Immediate, write down rubor. Rubor means red color, red hot. Suppose I have the inflammation. Gout, you know the gout? You know the rheumatoid arthritis? There is the inflammation of the bony joints, especially in the gout. It is always appearing to your feet, toe. But there is a very huge red color, that is rubor. Write down the word gout, G-O-U-T, gout. You see Google image, take the Google image and you will find how it looks like gout redness. Then calor, if you touch to that joint, for example, my elbow is inflamed, then if I touch, oh, it's hot. Then tumor, there will be swelling around my elbow joint. Then dolor, that is pain. These are the Latin words. Rubor, calor, tumor, dolor. Huh? So loss of function. I cannot move because there is a swelling. I will not able to move my elbow joint. So you have to take one example and explain to the examiner. So this is the next important keywords. Now, you have to write down the types of inflammation. There are mainly 2 types. Write down immediately. Acute and chronic. Acute and chronic. Acute means just now I have fallen down, I get a trauma and my shoulder joint is inflamed or back or the knee joint is inflamed, acute. But I have some disease for a longer time and I am having the inflammation of that particular organ. A kidney problem, nephritis. It's a chronic inflammation. It's not acute. Are you understanding? Okay. Acute means immediate. In Ayurveda, the words are ashukari vyadhi. Instant, within hours, within a day, ashukari. And this is jirna vyadhi. Jirna shotha. Okay. Now, about the acute inflammation, what is happening? It is early and short duration response of vessels. Vascularized means having a lot of network of capillaries, living tissue to the local injury. The changes can be divided into vascular changes and also cellular changes. In the blood vessels, there will be some changes. Inside the cell, there will be some changes in the inflammation. Okay. Now, one by one we will see. First, we will try to see the changes in the vessel. Write down changes in the vessel. Simple language. Vascular event. Changes in the vessel, blood vessels. Consist of, first is a hemodynamic changes. Quantity of plasma, quantity of neutrophil, quantity of platelet, quantity of RBCs. A specific quantity and quality is there. That is disturbed. That is called as a hemodynamic changes. Then altered change, vascular permeability. Actually, each, for example, this is a capillary and this is a wall of the capillary. So inside something is coming out and from outside something is coming in. So this permeability changes. This permeability is changing. Okay. Hemodynamic changes, the sequence is given. First, there will be immediate vasoconstriction. First, within few minutes, only 5, 10, 15 minutes, first there will be shock to the blood vessels and they will be constrict. That is transient means temporary, within only few minutes. Then next, gradually persistent, progressive, step by step, vasodilatation, permanent for next few days. Then slowing of stasis. accumulation. And leukocytes, leuko means white blood cell, soldiers fighting, WBC, they will immigrate. Immigration will take place. They will come out for fighting purpose with the bacteria. Altered vascular, altered means change in the vascular permeability. What is permeability? Going, some fluids, some material is going out and some fluid is coming into the vessel. Vasodilatation, then what will happen? Accumulation of edema fluid around the injured tissue. So some fluid, more fluid will come out from the blood vessel into the interstitial spaces. Space in between the cells is called as a interstitial space. Lot of fluid will be accumulated and it gives the swelling. Fluid is accumulated. Fluid is accumulated. Try to understand. The fluid is always a transudate, not very watery, little bit thick with some ingredients. Transudate. Next. Now we will talk about cellular event. What will happen inside the cell? Basically, in the cellular event, first is a exudation of leukocytes. Same thing, same like vessel. Exudation. WBCs will be more poured. Then changes in the form of element of blood. The sequence of events. What things are happening? Number one, margination. Margination is going soldiers out to fight with the bacteria. Margination. Then rolling and adhesion. Rolling and adhesion going towards the bacteria. Immigration towards a chemotactic agent which is attacking to the body. Then there will be phagocytosis, eating the bacteria, viruses, parasites. Phagocytosis, and intracellular, inside they will be killed and they will be thrown into the graveyard. Cooper cell, lysosomes. There is a graveyard also inside the cell, and these all the dead bacteria, viruses, organisms are poured or buried into that graveyard in the cell. Just I am giving you simile for understanding purpose. Leukocyte activation will be there. White blood cells are very much active because they want to take care of the cells, and extracellular release of leukocyte products. Okay, next. Now, when all the process takes place, there are a lot of chemistries there. Actually, Ayurveda students don't know much about the biochemistry. So I will not bother you much. I will not trouble your head very much. But just I want to tell you, in the inflammation process, these things are very easy to understand. Vessels, cell, WBCs are coming out, but lot of chemicals are released. Chemicals. And these chemical names, just you have to remember. Don't go for detail. Just remember some chemical names. I am going to tell you which chemicals are important. Chemical mediators which are responsible for this inflammation, which are the chemicals. They are broadly classified. Two types are there. Mediators released by the cells of injured tissue. For example, my joint, here I have made attack, trauma. Then the skin and the muscles and the ligaments, all the cells are injured. Cartilage, ligaments are broken, fibers are broken. So these injured tissue will also pour some chemicals. And then inside there are blood vessels. They contain the plasma. That plasma will also give some chemicals. So chemicals are coming from the injured tissue. Chemicals are also coming inside the body from plasma. So two types the chemicals are released. Now, mediators released by the cells of injured tissue. Number one, vasoactive amine. Amine is a protein. Some proteins are released. One is a common name, histamine. You forget about this below name. You just remember, write down. Histamine is very important in the inflammation. Histamine. Okay. Then there another is a arachidonic acid metabolite. Just remember, try to remember. I'm not saying 100% you will remember. You forget the below line. Don't go for this line. Only remember there are some chemicals like histamine, arachidonic acid metabolites. If by chance you remember, you try to remember. This is very important. This is very important. Prostaglandin. This name is very important. Please write down. Prostaglandin and say 10 times. Prostaglandin, prostaglandin, acute inflammation. Prostaglandin, acute inflammation. Prostaglandin, acute inflammation. These chemical names, at least 1, 2, 3, you have to write down in the examination. Then thromboxan A2. Okay, forget about this last name. Now, next we will go further. These metabolites, the products coming from the tissue metabolism via lipooxygenase pathway, they will move. They have the metabolic processes, chemistry is there, biochemistry is there. And then again, some names are important. For example, I will try to request you to remember this name. Leukotriene chemical is very important. Leukotriene, Leu, write down. Leukotriene, TREN. Just few names you remember. Another name, this is also important, cytokines. Please write down, cytokines. This also produces the inflammation. So I think you must remember the histamine. Can you see here? Then you should remember prostaglandin. Then you remember the leukotriene and you remember cytokine. Finish. Then now we will talk about the mediators from plasma inside, from blood. This one. Now here chemicals are not mentioned. Metabolic system is mentioned. Which type of the metabolic process takes place? So these are the some names as per the chemicals. So kinin system, I am not going to detail. Kinin system, clotting system, fibrinolytic. Fibrins are broken down. Fibrinolytic system and complement system. So you try to learn by heart. याद करने की कोशिश कीजिए. 10 बार पढ़िए और लिखिए mediators from plasma. That's it. Okay. Now this is very easy because these are all the names are familiar to us. The inflammatory cells. One is neutrophil. Make a short. Forget about polymorph. Forget about PMN. Neutrophil. Second, eosinophil. You know, these are the types of WBC. Okay. Basophil, lymphocyte. Then another few more cells are there. One is a plasma cell that you must remember. Neutrophil, eosinophil, basophil, lymphocyte and monocyte. We know. Only you have to remember plasma cells. Okay. This is the inflammatory cells which are taking, WBCs are taking active participation in the process of inflammation, protecting our body cells and destroying the bacteria and viruses. Okay, let us move further. We will talk about now chronic inflammation. Just now write down example: kidney, nephritis, chronic glomerulonephritis. Please write down. I will say 3 times. Chronic, write down. Glomerulonephritis. One more word. Chronic, pyelo, P-Y-E-L-O. Pyelo means pus, septic. Pyelonephritis, kidney problem. Third example I want to give you. Rheumatoid arthritis. Please write down. Rheumatoid, R-A, capital R-A, is a chronic type of inflammation. Chronic inflammation. One more example. Tubercular, because of the TB. Tubercular meningitis. Tubercular, this is very special. Huh? You know the bacterial meningitis, but I am telling you tubercular meningitis. Yes, this can happen. TB can affect your meninges, brain. Remember. Okay. So this is all about chronic inflammation. This is a prolonged response, many months, many years, in which tissue destruction and inflammation occur at the same time. The causes, what are the causes? Why the chronic inflammation? Number one, after acute inflammation, some days their inflammation process take remain over there. That is after acute inflammation, chronic inflammation continue. Now, second is a recurrent attack. बार बार हो जाने के बाद वो acute inflammation जब बार बार हो जाएगा तो it will be converted to the chronic inflammation. And some inflammations from the beginning they are chronic. They are always chronic. They are not acute type of the inflammation. Next, types of the chronic inflammation. There are two types. Please write down these. Chronic inflammation. First, chronic non-specific inflammation. Forget about next line. No, don't write that. Only chronic non-specific inflammation. And second, chronic granules, granular cells, granulomatous inflammation. That is, there is a formation of granules. So, granulomatous inflammation. First is a non-specific, second is a granulomatous. So, whenever any inflammation question is asked, whatever we have seen in these 2 pages, you have to write down. Okay? Minimum these things, some part, acute, chronic, chemical, this and that, you write down continuously. Rubor, calor, dolor, color, you write down. Okay. Next topic from the basic pathology. It is a fresh topic. So open the new page. All the viewers, they are requested to open the new page of the notebook and give the big title. That is healing process. Healing. Whenever there is a damage to the tissue, healing is always taking place. Now we will first see what is the healing. Okay. Healing definition, ability of the body, ability to restore, coming back to the normal structure and start normal functioning after getting, that means first there will be some trauma, injury will be there, and slowly and steadily, for example, always think of road accident and always damage to my legs, for example. There will be inflammation to the joints, inflammation to the different parts of the body. Pain will be there, redness will be there. And slowly after 8 days, after 10 days, after 15 days, gradually my body will recover from that trauma and normal structure will come and also normal function will come back. That is healing. After getting trauma, maybe physical trauma, maybe chemical trauma, maybe infectious trauma, maybe immunological trauma. But after 8, 10, 15, 1 month, 6 months, the structure will come back. Structure will come back, function will come back, and that is called as healing. Okay. Now, what are the different processes? First process is a regeneration. Whichever the damage, for example, in the jaundice, infective hepatitis A, jaundice, पीलिया रोग बोलते हैं हिंदी में, bilirubin level increased, urine, bile salt, bile pigment present, patient is suffering from hepatitis, virus A, not B. There, modern doctors, we give Arogyavardhini and Kumarias. Modern doctors say, do not give anything. Automatically, damaged liver will come back. There will be regeneration of the hepatic parenchymal cells. Automatic. Only 3-week rest is essential. Modern doctor says for the jaundice patient, only 3-week rest, that automatic regeneration will take place. Okay. In regeneration, healing is started. Proliferation, whichever the damaged cells, they are removed out and the new fresh cells multiply. Start multiplication of the newly formed cells. So multiplication is called as a proliferation of the parenchymal cells, and then there is a complete restoration. Can you see? Restoration, coming back of the original tissue. It will look like original. That means in the patients of jaundice, If we do by chance, nobody does it. But if you do the biopsy in the jaundice, nobody does it. But I'm imaginary research. Then during the period of 1 week, there will be some disturbance in the hepatic cells. But after 3 weeks, after 1 month, you will not see any damage. Complete okay. So this happens, for example, a small child of 5 years, he gets a high fever, cough, ras, bronchi, crepitation, pneumonitis. That pneumonitis, after the heavy antibiotics, intravenous saline, immediately after 2 days, if you again auscult lungs of that child, normal sounds. First, there were lot of ras and bronchi, crepitation, that is damage. But what is happened? Restoration of normal lung tissue. I hope you are understanding what is healing. You give all these examples in your examination. Write down all these examples, whichever the Dr. Deshpande is telling right now. When you give the examples, the teacher will be happy, definitely. Now, next, which cells can regenerate? Title is regeneration of cells. For some cells, it is possible. For some cells, it is difficult. But for some cells, it is not possible to regenerate. Are you getting my point? Regeneration is possible as per the different cells. For example, liable, you just write down these three names. Liable cell, write down immediately. Then stable cell, not next one, only liable cell, stable cell, and permanent cell. These three names you must write down. Liable, cursor, I will put the cursor so that you can see. Cursor, liable cell, stable cell, permanent cell. Now, liable cell, what are liable cells? Ability to multiply throughout the life. For example, my skin, damage, regenerate, damage, regenerate. So, skin cells are liable cells. They have the multiply throughout the life, no problem, absolute no problem. Stable cells, ability to multiply in response to appropriate stimuli. That means there is some need of proper physiotherapy, muscular regeneration, for example. Then application of some ointments on the hair. Then only they can have the ability to coming back to the normal. They need some what you can say, the medical advice, medical intervention to get again back to the normal, that is stable cell. And permanent cell lose their ability to proliferate around the time of birth. They will not proliferate. They will not multiply. Once the number is fixed, that number is fixed. For example, after the age of, for example, 5 years, all the neurons have their complete growth. With the food, they will physiologically continue to grow. But if by chance they get a trauma and cutting, 2 cuts, nerve, for example, vessel is cut, it can regenerate. But if nerve is cut, there is very less chance that nerve cells can regenerate. So they are called as a permanent cells. Okay. Next, healing topic finished. Whenever anything asked about healing, you have to write down only 3 marks. There will be no more marks. For 3 marks, this is sufficient. Now we will talk about what is the difference in healing and repair. We will see. There is little difference, not much. Moreover, they are same. But little difference. In repair, healing takes place. Healing is there by proliferation of connective tissue. Connection. Blood is a connective tissue. Connective tissue resulting in fibrosis and scarring. Try to understand. In the previous healing, there is a total, what you can say, the normal function, normal structure. But here, in the repair is a, what you can say, not 100% healing. It's a healing, but some damage. What is so damage is okay, na? Damage is gone, but fibrosis means non-elastic. Please write down. Fibrosis word is a non-elastic. Then scarring. Scarring is a type of fibrosis. I will explain you. I will explain you. Don't worry. Suppose I have a small wound, very, very small cut. For example, when I cut with the knife, some vegetable, and I get a little here cut. After few days, if you see that cut, no, you cannot see anything, nothing, gone, everything normal. That was healing. That was healing. But by chance, if I get a very, very big, some sword, crack, big cut, and then the stitches are there and everything, whenever there is a big wound, write down example, big wound, W-O-U-N-D, big cut with the sword, with the knife, big knife, and there is a tear, complete tear. You go to the doctor, anesthesia, and then the stitches. 5 stitches, oh my God. And if you see that wound, after 15 days, 1 month, you will see there is a white line, complete white line, because the 2 skin layers are not normal back as previous. No, it was not healing. It was healed. It is healed, but with the fibrosis, with the scar, permanent scar. This is just, I have given the 2 examples, a very small cut with some blade and all these things, but this is the big cut with the knife, stitches, then there is a fibrosis. This is repair and this is healing. So very interesting. I will give you another example. Tuberculosis patient. In the tuberculosis, if it is a mild infection, Mycobacterium tubercle, and complete treatment for 8 months, 1 year taken, complete healing is possible. But sometimes the patient is not taking treatment properly. He comes to the doctor very late and the big cavity is there. Tubercular cavity. Like a hole. Yes, in the lung, hole is there. Write down this example. Mycobacterium TB, cavity, TB cavity, big. Then when you give the treatment, streptomycin, isoniazid, everything, the patient will be okay. The TB will be cured. But that cavity will be repaired by fibrosis. Are you getting my point? Tubercular cavity will be repaired and not healed, and repaired by fibrosis. So when you make it again X-ray, TB patient X-ray, after 1 year, after 1.5 years, total patient is okay. No cough, no fever, nothing. Full energy, weight loss has been gained back, but you will see some white, very, very dark white spots. So what is that, sir? They are calcified lesion, Lesion. Fibrotic changes you can find out. Fibrotic changes. So that is repairing. Now I hope you have understood what is the difference in healing and repair. Both patient is cured, but here fibrosis is more important. Okay, what is that? In the repairing, there are 2 things can happen. Take the example of wound. You please make these Google images, granulation tissue formation. You will get a nice image. When we are healing the wound, always you can see there are small red dots. Small red dots are appearing on the surface, and that is called as a granulation tissue. Okay, they are helping for the healing. And then afterwards there is a contraction of the wound. First granulation tissue and then contraction of the wound. Now, granulation tissue formation. Granulation tissue formation, 3 phases. Please write down. In the repair, you have to write down first A and B. Write down. I will wait. Granulation tissue. Second is a contraction of the bone. Very easy to understand. No difficulty. No chemistry. No biochemistry. Very easy. आराम से ले लीजिए. ये granulation tissue formation में क्या हो जाता है? 3 phases है. First is a phase of inflammation. Of course, this is a defense mechanism of the body. Phase of clearance, everything will be all right. And phase of the new growth. What is clearance? All the phagocytosis takes place, bacteria, toxins washed out, they are buried in the lysosomes and Kupffer cells in the liver. But then we have to again make a regrowth. So there will be growth of granulation tissue. One is angiogenesis. Angio means blood vessels. Please write down. Damaged capillaries will be regenerate. Damaged capillary bed, BED, will be regenerated back. But unfortunately, some part of that wound is a fibrous tissue formation. Fibrous tissue formation. So this is all about granulation. Now next is here you can see contraction of the wound. And why this contraction takes place? There are 3 or 4 reasons. Please write down. Contraction, why? Why contraction? Number 1, their water, in Ayurveda it is clay, that will be taken out. Okay, so that is a dehydration. Water is taken out from that area, no excessive moisture. Then contraction of the collagen, fibers. And third is there are the development of muscles, that is myofibroblast. So because of these 3 things, there is a contraction of the wound. Next. So here you can see, after damage, 2 things are happening, 2 ways. One, damage, then inflammation, then regeneration, total back to anatomy and physiology, that is healing. Damage, physical, chemical, infectious, inflammation is there, repair, but repair with granulation tissue formation and contraction of the wound healing and fibrous tissue formation. So I hope you have understood the inflammation also, healing also, and repair also. See this video again and again and you will be understood. Now there is still some time. I would like to continue the fresh topic from basic pathology, that is thrombosis. Give the big title. Thrombosis is nothing but the stable blood clot. Please write down. Stable clot at one place. Stable blood clot. Thrombosis. Thrombosis. Please write down. Title is very important. Blood clot. One example you write down immediate. This is moreover during the heart attack. Write down heart attack. Myocardial infarction, MI, heart attack. Which vessel? Yes, coronary artery. In that coronary artery, thrombosis is formed, and that is detected by what we do? Angiography, correct? Angiography. And the doctor, your cardiologist, explain there is one vessel is blocked or 2 coronary arteries are blocked, 2 vessel disease, or 3 branches of coronary arteries are blocked, that is called as a 3 vessel disease. And that blockage is because of the cholesterol, atherosclerosis, thrombosis. Okay, definition. Thrombosis is the formation of solid mass. Try to understand. We will mark that portion. Usual style, concentrate. Cursor is there. Formation of solid mass in circulation. Blood circulation is going on from the constituents. How it is formed? Constituents of flowing blood. The mass itself, that solid mass, is called as a thrombosis. That is formed from the blood components. That is formed from the blood. The moving blood is there. So some components are stagnated at one place, and that is forming the thrombosis. Now, pathophysiology. Formation of thrombosis. Simple example. They have given the very simple example. The protective hemostatic plug. Can you write down? Hem means blood. Static. Stop. Hemostatic plug formed as a result of hemostasis. See the cursor. All the viewers, I request all of you, the students always get confusion in two words. Confusion in two words. First is a hemostasis. In the first year BMS Kriya Shari, that word is also in the pathology. Second word is a homeostasis. Homeostasis is totally different. Samadoshaha, samagnischa, samadhatu malakriya. This is homeostasis. My pulse rate is in between 72 per or in between 72 to 80. That is homeostasis. But when I have the cut by the blade and my bleeding is started, and within 2 to 5 minutes that is stopped, blood flowing from the wound is stopped, that is called as a hemostasis. So don't get confused in the word, and spelling is totally different. Homeostasis is different. H-O-M-E-O. This is hemo. Heme is a blood. Hemostasis, stopping of blood. Why? Why this my bleeding is stopping? Because of the formation of thrombosis. So, whenever there is a wound, whenever there is a bleeding, actually that hemostasis, plug, thrombosis is useful. But when it is occurring inside the body, inside the blood vessel, that is heart attack. My God. Heart attack or the brain attack or the renal attack. Anywhere, any blood vessel can be blocked. Srotorodha in Ayurveda. I will just pass on the one very interesting slok of Srotorodha Samanya Lakshana. Very interesting. Ati pravrutti sangova siranam granthayopi va vi marga gamanam chapi srotosam dushti lakshanam. Sroto dushti lakshana. Ati pravrutti sanga. That sanga is a srotorod. Remember that. Okay. There is scientist named Virchow described thrombus formation, and he has explained three important things for the thrombosis, that is called as a Virchow's triad. For the oral examination, this may be asked. Whenever there is a question of thrombosis, you have to write down these three things. That is endothelial. What is endothelial? Blood vessel. Wall. W-A-L-L, wall of the blood vessel, inner wall. That is endothelial injury is there. Altered blood flow and hypercoagulability of the blood. Clotting process will take place. Coagulation of the blood will take place. But first there will be injury, altered blood flow, platelet will come, and hypercoagulation of the blood will take place. One by one we will see. Endothelial injury. Capillary inside wall. The integrity of the blood vessel. That means intact blood vessel is important to maintain the normal blood flow. Whenever there is an injury to the blood vessel, that what will they will do? Expose the internal layer, that is a subendothelial layer. Can you see here? Subendothelial. I will mark for you. Vascular injury exposes the below. Sub means below the endothelial is the subendothelial layer, and that particular layer is thrombogenic. Thrombus formation, that particular layer is always try to help for the thrombus formation, so that is called as a thrombogenic. Okay. Now, injured vessel also there is a vasoconstriction, so the blood will automatically stop. Now, what are the things which can cause the vascular injury by which the thrombus formation is possible in all these conditions? Thrombosis is possible whenever there is a vascular injury. Remember, vessel injury, blood vessel injury. First, endothelial injury in MI. Myocardial infarction, that is heart attack. Myocardial infarction. These are also topic of basic pathology. Ischemia and infarction. Ischemia less blood supply to the organ, infarction, total stoppage of the blood supply. There may be myocarditis, there may be prosthetic valves, some mitral valve, tricuspid valve are damaged, and the artificial valves are kept over there. That can also get damaged, and then thrombosis is formed. Atherosclerosis, first there will be after old age, after 50, 60 plus, blood vessels become non-elastic, hard. That is arteriosclerosis, roughness is there. And you know, whenever there is a rough road, always the, excuse me, Gesundheit in German language, have a nice health. Okay. So whenever there is a roughness, the chances of waste is accumulation is possible. When the surface is smooth, nothing will stick up there, no adhesion. Everything will be washed out, blood will be flow smoothly. But when there is a roughness, cholesterol will be attacked, rather cholesterol will be deposited, platelets will be deposited, some waste products will be deposited of metabolites. So there is a problem, that is, first is the arteriosclerosis, only non-elastic roughness, and then atherosclerosis. Then even hypertension patients, they damage the blood vessels in the hypertension. Arterial diseases, diabetes mellitus, that also can damage the blood vessels. Hypercholesterolemia, just now I have mentioned, in the rough blood vessels, that bad cholesterol gets deposited. Cigarette smoking, nicotine is a vasoconstriction, again some waste will be accumulated. Now, the role of platelet in thrombosis. The platelet which are moving in the blood recognize the vascular injury. Oh, there is a trauma, and they fast go there and stick up over there. They go and protect. They make a like a shield, okay? Adhere to the exposed subendothelial layer with the help of von Willebrand's factor. Don't worry, just remember chemistry, biochemistry. This is one chemical, von Willebrand's factor. With the help of that chemical, platelets make an adhesive tape. Platelet release reaction. The activated platelets undergo, that platelets will again stimulate to welcome to the new platelets, new formation and new welcoming to the platelets. So it's a positive cycle, positive feedback. Remember, this blood clotting mechanism is a positive feedback. We have learned this in the Kriya Sharira physiology subject, negative feedback and positive feedback. Hormonal is always negative feedback, TSH and TSH. But this blood clotting is an example of positive feedback. Breast milk suckling is a positive feedback. Labor pains, positive feedback. 3 examples of positive feedback. Okay, these platelets will again welcome to the new platelets group. So here, platelet aggregation. Due to the granules, additional platelets come, that is called as a secondary aggregation, and temporary hemostatic to stop the blood plaque will form. Now, role of this clotting system, extrinsic and intrinsic pathway. Coagulation is a blood clotting. That is, these are the system converts fibrinogen into fibrin. There are, the 12 clotting factors. So this is all process is there, and thus thrombosis form. Now, what are the reasons for that? Alteration of the blood flow, turbulence. Turbulence means movement. Turbulence means unequal flow. Unequal is not a smooth flow. Unequal. And stasis means slowing down. It's not normal speed it is getting, but speed is also lowered down. Due to the alteration, platelets in the central stream of the flowing blood marginate. They will go to the damaged cells, marginate to the periphery, and turbulence also causes that irregular blood flow will also damage more to the endothelial lining. Next, hypercoagulability of the blood. Next factor for the thrombosis, increase in the coagulation factors like fibrinogen, more formation, then factor number 7A, factor number 8A, factor number 9A. You know these factors, clotting factors. Increase in the platelet count, decrease level of anticoagulant. Coagulant, opposite is, there is always a combination in the blood. Coagulant factors, anticoagulant factors. But here we want to stop the blood. So anticoagulants will be lowered down and clotting factors will increase. Simple. Factors favoring the coagulability. Which factors are very nice to get the coagulation? One is the advanced age, cancer. This is, you see, this is another way I am telling you. That means they say that blood clotting pathological. Now this is pathological. Inside the blood vessels. Inside the body. Now I have the cut and I want to stop the blood. It is okay. That is physiological. That is okay as a treatment. But if inside my blood vessels, in the heart, coronary arteries, if they are blocking inside, that is a problem. Inside thrombosis, inside the body, inside the vessel, thrombosis is dangerous. And that is that. Inside, that is advanced age. In the old age, thrombus formation inside the body, in the coronary arteries is more possible. Cancer, trauma, smoking, and OC pills the ladies are taking to prolong their pregnancy. New couples, they always take the Mala D tablet, oral contraceptives. That also can cause the thrombosis formation. Which are the clinical conditions where you get this thrombosis? First, heart diseases, like for example, myocardial infarction, chronic heart failure, that is CCF, cardiomyopathy, that is cardiomegaly, big of the heart, mitral stenosis, stopping, the valve is damaged, mitral valve. Vascular diseases like atherosclerosis, just now we have seen, varicosity of the veins on the legs. The people who are standing for the longer time, they get the varicosity of the veins because of the stagnation of the blood. Blood is not coming back normally. Then hypercoagulability conditions like polycythemia vera, like more RBC count, then nephrotic syndrome about the kidney, that also can cause this particular coagulation problem. Now, next is a last few minutes, fate of thrombus. What will happen if this thrombosis takes place? So here is that fibrolytic system activates. Or rather, sometimes we doctors in the ICU, intensive care unit, or CCU, cardiac care unit, we give the streptokinase injection. Write down streptokinase, STREPTO. That will dissolve this thrombus. Thrombosis will be dissolved. That is also called as a blood thinners. That will make the in the colloquial language, in the patient language, we always tell to the patient, we are more liquidifying your blood. It is solidified, now we are liquidifying. आम्ही रक्त पातळ करण्याची औषध देतो आहोत in Marathi language. In Hindi also we say रक्त पतला करने का हम दवा दे रहे हैं, एस्पिरिन जैसी दवा दे रहे हैं, है ना? तो हॉस्पिटल में हम कौन सा इंजेक्शन देने वाले हैं? Streptokinase, and this is given in the heart attack, this is given in the paralysis, hemiplegia, brain problem, because this should be given in the first 4 hours from getting the symptoms. So 4 hours after heart attack, 4 hours after the brain problem, admission is very important. And that's why these 4 hours, all these things you can write in the examination. These are called as a golden hours, because this is related with the thrombus. If you give this streptokinase, there will be chances that the patient can remain alive. We can prevent the death, and also we can prevent the damage, physiological damage. Okay, so streptokinase, don't forget this name, for to dissolve the thrombus. Then sometimes propagation, the thrombus will increase in size, or there may be formation of thromboembolism. That means from that thrombus, some part is separated and it starts moving into the blood here and there, and that is called as embolism, which we are going to discuss in our next lecture. So my dear friends, This is all for today. We have discussed many topics today of basic pathology. You write down number 1, inflammation. Number 2, healing. Number 3, repair. And number 4, we have discussed thrombus or thrombus formation. Okay. So take care. All the best. Tomorrow we have the at 7 p.m. the lecture or the class of Sri Roga Prasuti Tantra Vidyan. I will try to see some part from the paper 2 also. That means related with the Sri Roga. But I will tell you there are a lot of videos in the playlist of medicine class. Please see on my YouTube channel Ayurveda Academy. There are a lot of videos related with the gynecological problems. Even if you open that Sri Roga Prasutantra playlist, you will get many problems I have discussed. In the medicine also, I have discussed the PCOS, PCOD I have discussed. Then I have discussed the causes of excessive bleeding, menstrual bleeding. I have discussed this, amenorrhea. All these videos are there. Please, leukorrhea, all these videos are there. Please check that video. But otherwise, we will discuss something in the tomorrow's class at 7 p.m. Thank you very much. Have a nice evening. Take care.